Have you ever seen a therapist, or maybe you've wanted to see a therapist and you haven't? Well, in today's episode, you're going to visit with Shelley Fourney, and she is a licensed therapist who specializes in solution focused brief therapy. Now, I'm not going to promise that you're going to have all the tools you need to navigate whatever stress is going on in your life, but if you're trying to make a habit change, or if you just need a starting place to take those first small steps, you're going to love this interview. I'm Dr. Vicki Petz Casper. I practiced obstetrics and gynecology for 20 years until I landed on the other side of the sheets as a very sick patient. When my own body betrayed me, I took a handful of pills to manage my disease and another handful to counteract the side effects. My health was out of control. Through surgery, medications, and lots of prayers, I regained my strength only to face another diagnosis. My doctor challenged me to make radical changes through lifestyle medicine. Now I feel great, and I want to help you make changes that make a difference. Healthy Looks Great on You podcast takes you to many medical schools so you can learn the power of lifestyle medicine. If you're ready to take control of your health, you're in the right place. Whether you're focused on prevention or you're trying to manage a condition, I'll give you practical steps to start your own journey toward better health, because healthy looks great on you. I am so excited to have you meet my guest today, Shelley Fourney, and she has a ministry called Intentional Steps. I guess it's a practice.
Yep.
I'll let you tell us about that. But managing stress is something I need to hear today. So, Shelley, tell us about yourself.
Yeah. So I'm a licensed clinical social worker, which in Colorado and various other states allows me to practice as an individual therapist in a private practice. I'm licensed in Colorado and in Texas. And I actually have a practice. My office is in my home, and I work with clients, variety of ages. And one of my favorite things to do is help them move forward a little baby step at a time, not big steps. And I also do some speaking and workshops on the side. And I've also been certified in AcuDetox, which is 5-point ear acupuncture.
Oh,
So,
cool.
yeah.
So, when it comes to stress management,
Yep.
like I said, I'm pretty stressed today. I've been dealing with some issues with the IRS, and that will make your stress go through the
Yeah.
roof.
Yep.
So when you talk about little baby steps, just tell us what that looks like.
So I think so often when we're trying to manage anything, we sort of dive in and hope to plan for the next 6 months. And so, like your IRS, example, I would say for today, I would wonder what is it that needs to happen so that when you get through your day today, you're like, oh, I managed fairly well. And I like to ask people those questions so that they can begin to think what that would look like for them. I'm not an expert on your life, but you are, right? My job is to ask you good questions to help you facilitate what it is you want. And so for today, it might just be that you want to get through the day. And so I would wonder, what does it look like for you to get through the day? That's what I would ask.
That's awesome. And I've heard you say before that you are solution based. And I love that. I
Mhm.
want you to talk
Yeah.
about solution based. But I'll tell you what I need to get through the day. I have an
Yes.
appointment to go to
Okay.
the office tomorrow to prove my identity because they can't figure out who I am. But I'll tell you another thing that really relieved my stress. My husband and I are taking dance lessons, and
Oh,
we're learning to do the West Coast swing. And after I texted him several of the mad emojis because I had been on the phone with the IRS, he texted me a video of our dance instructor showing us the steps. And I was like, that's what I need to do to manage my stress right now is just go practice dance.
oh. And was it helpful?
Absolutely.
Yeah. Okay. Yeah, because it's crazy the things like what works for me isn't going to work for you, right? And so knowing yourself and really saying, okay, what do I need in this moment to kind of regroup, to turn it around just a little bit? is often really effective.
That's really cool because, like, so many times we get a prescriptive piece of
Mhm.
advice, like, you should go dance because that will relieve your stress. And somebody else might be going, that won't relieve my stress.
Well, it kind of puts me in a position of being the expert on you. Okay. So very often I worked in primary care for a while, and I would go in with, medical providers and help them work with patients around all kinds of things: sleep, stress, anxiety, depression, all of the things. And at first, I would try to go in with my list of 20 tips. And you're a doctor. How often do you think that was effective?
That's a good question. I mean, occasionally it was, but I will say that sometimes when it was, I was actually sort of surprised.
Mhm. Almost never did they do them. And what I started to figure out was if I can help somebody by asking some questions, um, just the way I asked you, and you're like, oh, well, the dancing was really useful. It's something that works for them. It goes so much further in terms of making an effect.
That's really encouraging for me to hear because, like I said, when I was in practice, I would tell people, you need to quit smoking. And occasionally they would come back and say, I quit smoking. And I'm like, you did? And
I
now
didn't
I'm
expect you to. Yeah.
now I'm teaching a class on
Yeah.
sleep, and this whole first 2 weeks of the course are videos where I do ask, what are your goals? What are your sleep problems? How
Yeah.
are you going to solve them? And
Yes.
so I'm feeling good about that.
Yeah. I'll ask somebody when I was working with somebody that wanted to quit smoking, let's say, or their doctor really strongly encouraged it. I was like, well, why do you want to quit smoking? And they'd be like, I didn't know that mattered. And I'm like, it actually really does. Like,
Mhm.
if it's not important to you, it's not really important. And often it was important, but for different reasons than the doctor might have.
Right. You have to tap into your internal motivation.
Yeah, very much.
So
Yeah.
tell me what you mean by solution focused.
Yep, solution focused. It's called solution focused brief therapy. And I work with a trainer and have been trained for years with a lady in Denver. Her name's Terry Pichot. And she actually worked under the founders, in Sue Kimberg and Steve DeShazer. And the whole focus of solution focused is what what do you want? And if it's working, let's not fix what isn't broken. And so very often it looks like finding out what somebody wants, and helping them move forward. Now, if somebody's really in a stressful situation, maybe there's been a loss, then often we change that slightly to work on what they need to manage and what they need to get through. So that can look like minute to minute things. It can look like a week at a time. We really adjust the modality to fit each person. And it's also been really effective. I've noticed that my level of stress working with clients and my burnout rate has decreased dramatically.
That's really awesome.
Yeah.
And so when you talk about baby steps, can you give us an example of something that's
Yeah.
just a tiny little step in the right direction?
Yeah. So, like, people want to change things all the time, right? And at the beginning of the year, one of the things that I kind of promoted on social media is maybe instead of setting all these New Year's resolutions, we could have a peek into our own lives about what is already working. Meaning, we all have routines. We all have things we do every day, right? So today for you, your husband sent you that video. It sort of clued you in to like, oh, I'm going to go practice for a few minutes, right? So that's a tiny step that you did to just sort of, instead of where you feel like your day is just disintegrating, you were able to kind of stop and turn it around and head back in the direction you want to go. Is it a quick fix? Probably not, but it did impact your day. And so that's what I mean by tiny steps. If somebody's deep in grief, for them, it might just be, hey, what do you need to get through like the next hour? And very often, people in deep grief, when they've just lost somebody, they're focusing on things like, I need to drink, I need to eat. And so we'll focus really, really basic. And I think my role in those situations is validating what they've decided is the tiny step.
I love that. That is so powerful.
Yeah, it's amazing to see somebody kind of use this technique and to change lots of things about their life. It's all things they've come up with, if that makes any sense. My job is to ask really good questions, right? And be listening to what it is they're telling me and help them find the things in their life that will work for them.
That's so fascinating. And a lot of times I hear from people when it comes to stress that one of the things they struggle with is just recurrent spinning thoughts.
Yeah.
Just digging that rut in their brain is what I call it.
Yes.
Do you have any suggestions for how people can stop that process?
Um, it's funny that you asked me that because I struggle with that. If I'm really stressed, that is for sure the one of the first things that happens for me. And I've been doing a lot of reading about this. And one of the things that I have heard repeatedly is I would call that a form of feeling anxious, right? And so when that anxiety happens or starts, we can't be grateful and anxious at the same time, which I'd never really thought about it like that. I mean, I definitely practice gratefulness, but when I began to focus on, okay, what am I grateful for in the moment? And also, even if it was a mistake I made, if I could begin to show myself some compassion or grace. So instead of, well, you really screwed that one up, or way to go, or I can't believe you said that. And then we ruminate over that over and over, instead saying, listen, this is how we learn. You're learning how to do this differently. Something else that I'm actually posting on my social media this week, so it's really funny that you asked this, is have you heard of hand to heart technique?
No.
So you put your hand on your heart. I have to be honest, a therapist shared this with me years ago, and I thought like that's ridiculous. So as I looked into it, I've noticed that when I put my hand on my shoulder in the moment, when those thoughts are going, it automatically calms me. And so I looked it up, and it isn't, there's nothing woo woo about it. It's actually biology. So the act of touching ourselves, in a calming way actually tells our nervous system, hey, we're safe. And so I was just like, oh, this is fascinating. Like, I love this because at first I was like, that just feels weird. But also it clues me into like, how are you talking to yourself right now? What is it that you really are going to accomplish by beating yourself up? That only increases the rumination.
I have not heard that about touch. I know touch from other people releases oxytocin, and that
Yep.
does a lot to mitigate stress. And I know there are scientific studies that show gratefulness
Yes.
really is a powerful stress management
Mhm.
tool.
Yep. So those are a couple things I've just been experimenting with and finding that really seem to be helpful.
That is very interesting. I love that. So one of the things that I try to do, especially when I was seeing patients, is to celebrate small wins and to give
Yes.
people a goal of accomplishing something that they can achieve pretty easily.
Yes.
Um, do you ascribe to that? Is that
Yeah.
helpful?
Yes. And I find that very often though, sometimes people can get stuck on those goals because it really was a little bit too big. So I'll sometimes have people come back and be like, I've been trying to do X and I just can't get myself to do it. So then as we dig in a little bit, I'll start to ask some questions. And let's just use exercise because a lot of people try to implement that, right? And so they think that, okay, well, that means my first step is taking off and walking every day. I would argue maybe that's too big. And so, can we back up a little bit to find out how are you? So, I would probably ask them, given that you've not been exercising, How do you see that happening? And just listen to what they have said. And very often, some of the first steps are figuring out, I'll ask people a lot of how questions. So, how are you going to do that? What time of day are you going to do that? What are you going to wear when you work out? Are you going to do it every day or is once a week enough? So, a lot of those questions to really pare it down for them. And I find that they're even more successful because
Yeah, because if you say I'm going to walk every day and you walk 4 days in a row, but then you miss that fifth day, we failed.
100%. Well, and if you take somebody that's not been walking at all, right? One day in a week is success. So I try to dial it way back and ask them, this isn't about where you'd like to be ideally. We're working on that. What is it for this week? What is it for today? And so for today, it might be something as simple as I got to figure out my shoes because I don't think my shoes fit me and I need new shoes. And so I try to really emphasize to them that that is a baby step. That is a step in the direction that you want to go, and really hammering out, I guess, or helping them sort out what those different things are, I feel like leads to a lot more success. And it also teaches them how to transfer those questions to other things, right? This isn't any technique that's just huge rocket science that only I can do. I want to work myself out of a job with clients.
Well, that was actually my next question, and I thought it was going to be a hard question for you. But what I was going to say is, not everyone has a therapist or a counselor that they
Yeah,
can. I 100% believe in counseling. I've been to counseling. I think it's super important, especially if you have an issue you're struggling with. But not everyone has access or um,
funds.
funds, and hopefully there's not much stigma around it like there used to be. But how do you have a message for people who are like, you know what, I don't have anything major going on. I obviously would like to do some things to improve. For me, it would be for their health.
Yes.
Are there some tips that you can give us for where do you start and how do you combat that negative self-talk and keep
Mhm.
yourself motivated?
Absolutely. I also see a therapist and I also do some work on my own, right? Because I don't always want to have to go to therapy necessarily. So I would say asking, what is it that you want? And when you answer that question, I don't mean things like $1 million. I mean, hope, peace, happiness. What are the things that all of us would consider a universal wish, if you would? Maybe not a wish, a universal goal, right? Because I don't think you'd argue with me that having peace in your life is good. So what is it you want? And then I ask people to come up with a visual word picture. So when I'm sitting with somebody, I get so detailed that I can visually see it in my head, if that makes sense. I need to be able to see what they're talking about. So when they say happy, that doesn't really mean anything to me. I would wonder, what does happy look like in your life? What are you thinking about? What are you feeling? What are you doing? And then I would ask, how are we going to do that? And I would dig in a little deeper. And I find it just makes people feel as if they can do this. And that's my goal. My goal is not to, I tell people, this isn't a life sentence. I don't want you to have to come here indefinitely. Um,
Yeah.
so, yeah.
I love that, painting a picture of the vision of
Mhm.
where you are or where you want to be.
Yeah.
I do that in a couple of different ways in my course, and one of those is to create a mission statement.
Yeah.
And I also have a graph of a journey that says you are here. Figure out what it is that you want. That's your goal. And then I'm going to help you fill in the steps
100%.
to get there. But if you don't know what it is, people always say, well, I want to sleep better. Well, why do you want to sleep better? I mean, for me, I want to sleep better because my health is important to me. I'm
Yep.
60, I have health issues, and I know how intimately related sleep and health are. And
Yes.
so I want to sleep better so that I can enjoy health and spend time with my family and husband and friends and children and grandchildren and enjoy life.
Very much. And I mean, sleep for me, I get to operate out of a lot better me when I'm sleeping. I mean, a couple nights of not sleeping, my anxiety might be higher. I feel more stressed out. I'm maybe a little more irritable, all the things.
Many things with physical health are
Mhm.
related to mental health, and
Yes,
they sort of spin in a vicious cycle. Like this causes this to be worse, which causes this to be
totally.
worse, bidirectional for sure.
Yep.
And when you said spinning thoughts was anxiety, ironically, I really never thought of it that way.
Mhm.
For me, it's probably sort of grasping for a sense of control.
Mhm.
Like, I'm going to think about this over and over and over till I have it figured out. And I never really realized, and you're right, that is anxiety. It's feeling lack of
Yes.
control over a
Yeah.
situation. And so
Yeah.
I'm grasping for
Very
control
much.
and I'm
And
just,
it often comes from a really good place, right?
mhm,
Like it's not necessarily bad that you want that, right? I think it's a reminding myself like, hey, it's okay that you have that thought. And probably you're not going to sleep great if we continue on.
yeah. And I also say the place of perfect peace, place of perfect surrender. And so I have a prayer that I do that's whatever, Lord, whatever.
Yes. Yes.
And that
Yep.
usually calms my anxieties. It's like,
Yep.
I'm not in control. You are. You can have it.
And for me, sometimes it's not enough for me to even say it. So I will journal it. I will
Mhm.
write it. And the act of writing, even if I have to get back out of bed, which is hard for me to do, but I will feel almost the tiredness set in as I write. I'm like,
Yeah.
okay, now I can go sleep.
You know what I've said for 30 years?
Why?
A journal is a cheap psychiatrist.
Oh, my opinion? I mean, honestly, if I could, I can't prescribe, but if I could, I would prescribe exercise, healthy eating, and journaling to
I
everybody.
love it.
Yeah. Yeah.
We are definitely on the same page.
Hmm.
Well, this has just been
Thank
fantastic.
you for having me.
Yes, I love it, and I love the name Intentional Steps. I think that was well chosen after hearing your mission. I
Yeah.
think that's awesome.
Thank you. Thank you so much.
Oh, you're welcome. The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.